You've just been told your rotator cuff tear is irreparable. The tendon's gone, the muscle's worn out, and a standard repair isn't possible. Does that mean you're out? Out of options? Not anymore. In 2025 and into 26, surgeons have advanced procedures that can still bring back real shoulder function. Hey there, I'm Dr. Dan, orthopedic surgeon who's helped a lot of people through shoulder surgery and shoulder recovery. My job here is simple. It's to cut through the noise so you heal smart. Today we're continuing our look at irreparable rotator cuff tears. In part one, we covered partial repairs, biologic patches, balloons. So if you missed that one, check it out. We'll link to it below. Now we'll explore what happens when the tendons truly can't be repaired and how some modern techniques can actually still restore some motion. Maybe not completely normal, but motion nonetheless. Let me tell you about George. George, 68, loved gardening. After his tear, he couldn't even lift a watering can. His MRI read, massive, chronic, irreparable tear. He thought that was the end. But modern options gave him another chance. If you are preparing for shoulder surgery, grab my pre-op checklist. The link is below. It'll help you ask the right questions and plan for a smoother recovery. Sometimes tendons retract, pull far back, and that muscle shrinks and it fills with fat. We call that fatty atrophy. The joint may develop arthritis and the ball starts to slide around upwards and sideways because the rotator cuff no longer centers it. At that point, pulling the tendons back is like trying to stretch rope or a bad looking rubber band that just falls apart when you try to stretch it back. That's pretty lame rubber band. I don't have any more, so I guess I think that rubber band was probably from like 1932. But anyway, so you can't pull it back. And the tendon gets stiffened over the years. And so instead of forcing it, surgeons now look for ways to replace that lost function. Not necessarily replace the rotator cuff, but the lost function. So now sometimes the torn rotator cuff just can't be brought back to the bone. Just like we described before, no amount of stretching or stitching will reach. That's when surgeons may consider a tendon transfer. So basically rerouting a healthy muscle tendon unit to help replace what's lost. So let's take a closer look at what a tendon transfer really means, where these tendons come from and where they attach, and what they can do and what they can't do, especially compared to the supraspinatus tendon, which is one of the most often torn. So the supraspinatus sits on the very top of the shoulder, and it helps lift the arm away from the body, what we call forward elevation. When that tendon is retracted or destroyed, you lose a smooth elevation, lifting of the arm, what many people call a dead arm. Surgeons can't replace the supraspinatus directly because it's gone, and there's no spare part for it specifically. So instead, they look for nearby muscles that can mimic some of its functions. There are two main options today in 2025 and 2026. That is the latissimus dorsi transfer. This is a large back muscle that normally helps us pull objects down, or think of rowing, that rowing action, that's working on the latissimus dorsi. In the surgery, the tendon is detached from the back of the arm, and it's rerouted up to the top side of the back side of the shoulder. And it's anchored near where the rotator cuff used to attach, more so where the infraspinatus is, not as much as where the supraspinatus is. So once healed, it assists with external rotation and adds some power to lifting the arm. So it does not fully recreate that smooth overhead lift of the supraspinatus, but it can restore strength below shoulder level and reduce pain. And it does help with the whole function of the shoulder. Now the next one is a slightly newer technique called a lower trapezius transfer. Now this is a little more complicated. This muscle sits along the shoulder blade and pulls the arm outward and upward in a coordinated kind of shoulder motion. When it's transferred, we need to use a graft because it's not long enough to get to the shoulder. So we often use a piece of strong tissue like an Achilles tendon from a donor, or sometimes even now we're using some other tendons from around the body and the foot. It helps restore rotational control. It's a little bit better in centering the ball in the socket than the latissimus dorsi transfer. So it's a little bit more anatomic improvement. However, It's a bigger surgery and it requires a donor tissue, whether it's your own tissue from another part of your body or someone else's tissue. Again, both procedures aim to rebalance the shoulder, not rebuild it. They can't perfectly reproduce what the supraspinatus did, although maybe the lower trap transfer works a little bit better. They can improve motion, reduce that heavy dead arm feeling, and often delay or prevent the need for the shoulder replacement. The key to success lies in rehab. The transferred muscle has to be trained to think in a new way. It does a different thing. That means months of guided physical therapy and careful, slow progression. When it's done right, many patients gain meaningful range of motion and comfort, even if they never return to full overhead strength. So a tendon transfer doesn't give you a new supraspinatus, but it does give you a new shoulder that can help carry some of the load. So if you do get it, it's going to be longer than many of the other options. So what do the studies say? In 2024, a systematic review showed both latissimus dorsi and lower trapezius transfer improved forward elevation by about 30 to 40 degrees and cut pain scores in half. So pretty good. When patients stick to therapy and the joint remains healthy, satisfaction rates reach around 80 to 85%. But if you already have arthritis, then that's not going to work as well and probably transfer from a tendon transfer to something different. But in the right person, this is a really useful tool. So our next option is the reverse total shoulder. If you'd like to see what a reverse total shoulder replacement actually looks like and how it changes the shoulder mechanics, I made a detailed walkthrough video before, and we will link to that video down below. So for many adults over 60 with chronic cuff tears or arthritis, the most predictable option is the reverse total shoulder. Instead of repairing the tendons, the surgeon replaces the joint and flips the design. So the ball goes on the shoulder blade where the socket used to be, and the socket is actually on the upper arm bone and not the socket. So that reversal lets your deltoid muscle do the lifting instead of the damaged rotator cuff. The research here is actually really strong. In a 2024 report, the American Shoulder and Elbow Surgeons Registry showed over 90% patient satisfaction and more than 95% implant survival at 10 years. So most people regain the ability to raise the arm to shoulder height or higher, and pain relief is nearly universally decreased. Recovery takes patience, usually 4 to 6 months before daily activities feel natural, but the improvements in quality of life can be dramatic. And for many, it's the operation that finally brings back restful sleep, independence, and confidence. Interestingly enough, it's not as arduous a recovery as a tendon transfer because those tendons don't need time to recover as much because we're actually replacing the joint. So George's first weeks after surgery were slow, but by month 3, he could lift his arm to his shoulder height again. By month 6, he was pruning shrubs with confidence. The takeaway, even when a rotator cuff can't be repaired, function can be improved or restored, whether through a tendon transfer or a reverse total shoulder replacement. The goal isn't perfection. It's freedom from pain, and a return to what you love doing, in your independence. So if you've been told your tear is irreparable, remember, you still have options. Across these 2 videos, we covered many options, everything from biologic patches to full reconstructions. If you found this helpful, hit the subscribe and turn on the notification so you receive notifications about the next video. Again, don't forget pre-op checklist. Links below. Thanks for watching. Take care of that shoulder. We'll see you next time.